I think when small privately insured companies or small insured companies looking for health insurance for their employees are moving out into the marketplace, it's very hard for them to get a good deal and know if they're getting a good deal on their insurance and to shop around. When I hear small employers talk, they talk about the frustration of that. One of the things that I would suggest would be looking for ways in which small employers can band together and can purchase perhaps on the same footing as a large employer. The Wyoming Business Coalition on Health, for example, doesn't actually purchase health insurance, but they work with employers to understand what those issues are. There are association plans, chambers of commerce, other business groups that sometimes they're an industry-specific business group like restaurants and lodging association who can help small businesses understand what their particular needs are and help them find policies that meet their employees' needs. The strategy for sustainable and accountable health care in Wyoming is to focus on value of care, which is the quality of care that you get for the price that you pay, and to do that by very carefully measuring three particular things: your total population health outcomes, so what are you achieving, the outcomes from the individual processes of care, and you can do that by looking at process measures, but also by doing patient surveys and seeing if patients are what their perception of quality is, and then finally looking at the cost per capita. And it's important to look at the cost per capita because you may, as a purchaser or a payer, be willing to or want to spend money on things up front like prevention care, wellness care, in order to save money in the long run. And so you need to be able to capture both those expenses and those savings by looking at per capita costs. Wyoming faces in some ways the same challenges that other states do and that we do as a nation and that families do, and that is that healthcare is consuming a larger and larger piece of our budget every year. We have some unique challenges in the sense that we are such a large and rural state, and our population is distributed across a very wide area. So it's very hard to get the provider delivery system in place in those very, very rural areas. And one of the things that we're working on is telehealth and telemedicine. And we already have a very successful telemedicine program with the University of Washington to provide child psychiatry examinations or analysis, which is turning out to save us a lot of money and be better for the kids because we don't have any child psychiatrists in the state. So we use telemedicine and we get the care that we need to the people that need it when they need it. I think there are states around the country that have addressed some of the issues that we in Wyoming need to address. For example, there are other rural states that, like North Dakota, that have done a pretty good job of integrating their delivery system and organizing that. There are other rural states like Utah that have done a good job of organizing their insurance market so that it's more transparent. I don't know that there are any states that we could just wholesale pick up what they've done and put it in Wyoming, because we have some pretty unique concerns here, both in terms of how our population is distributed, how our provider delivery infrastructure is distributed, etc.